Hello, my name is June Rogers and I'm a specialist children's nurse. This short little video is all about bedwetting and why it happens. Lots of children have a problem with bedwetting, sometimes called nocturnal enuresis, so you are not the only one. If you are aged 5 years or older and still wetting the bed, then there are lots of things that can be done to help you get dry at night. First of all, we are going to explain some of the reasons why bedwetting happens. This picture shows that we have two kidneys that look like little beans and a bladder that looks like a balloon. The kidney makes wee and the bladder holds onto the wee until it is time to go to the toilet. The bladder lets us know when we need to go to the toilet when it is nearly full. We will explain how a problem with the kidneys or bladder can cause the bedwetting. There are other things that can cause bedwetting and we will explain those as well. Some children wet the bed because their kidneys produce so much wee at night that their bladder cannot hold on to it all and so it empties while they are still asleep. This is called nocturnal polyuria and is caused by not having enough of a special chemical messenger called vasopressin. Vasopressin normally tells the kidneys to reduce the amount of wee we make while we are asleep, so we can sleep through the night without having to go to the toilet. Some children wet the bed because their bladder is too small or a bit twitchy, so it empties before it is full. This is called an overactive bladder. Some children who have this problem with their bladder also can have some problems with wetting in the day or having to dash to the toilet. If you have this problem with your bladder, then it is important to speak to your nurse or GP for further advice. All children who wet the bed have a problem waking up to go for a wee. This is called lack of arousability and is not caused by laziness or sleeping too deeply. Bedwetting can run in families, so if both your mum and dad wet the bed, then you will have a high chance of also wetting the bed. What you drink, how much and when can affect the bedwetting. Some drinks make bedwetting worse, especially drinks that are fizzy or contain something called caffeine. Some children drink too much in the hour before bed, and lots of children don't drink enough during the day. Try to keep a note of what you drink in the evening and how wet you are. If a particular drink seems to make the wetting worse, then try not to drink it in the future. If you are constipated, that means not doing a poo most days, or if poos hurt or are difficult to push out, that can make the bedwetting worse. Try to do a poo every day. Eating lots of fruit and vegetables and drinking plenty of water-based drinks helps. Speak to your mum, dad or carer if you think you may have a problem with your poos. Bedwetting often improves if any constipation is treated. So now you've learned a bit more about why bedwetting happens. So some children wet the bed because they make too much wee at night. Some children wet the bed because of a problem with their bladder, and other children wet the bed because they don't wake up in time to go to the toilet. And some children can have more than one problem that causes the bedwetting. We also know that other things, such as being constipated, can make the bedwetting worse. However, whatever the cause of the bedwetting, you need to remember that it is not your fault and there are lots of children out there who have the same problem as you. If you do want to know more about bedwetting, the causes and the treatments available, then do speak to your local nurse, health visitor or GP. Bladder Bowel UK is a national charity and we have lots of resources on the website and a special helpline when you can get further advice and information from specialist nurses. So please do get in touch if you want any more information or advice.